Hi, and welcome everyone to Medicine with Ali's. We'll be talking about anemia. Anemia is a very, very important subject. Why is that? Because it will come in your exams in internal medicine, family medicine, USMLE, SMLE. You will be faced with anemia definitely, even during your college exams. All right. Now the basics of RBC production. How do we produce RBCs? Whenever the kidneys are hypoxic, whenever there is not enough delivery of oxygen to the kidneys will produce erythropoietin. Now, this erythropoietin will go to the bone marrow, and in the bone marrow, reticulocyte will be formed. Those reticulocytes will transform into RBC, will mature into RBC. Then we will have the hemoglobin production and RBC. All right. This is the basics of RBC production. Now, what does that tell you? It tells you, when you have a CKD patient, stage 4 and 5, those patients usually will have deficiency in erythropoietin. Why? Because their kidneys are unable to produce erythropoietin. That's why we give them something called darbepoetin, which is erythropoietin analog. All right. Now, how do you define anemia? What's your definition of anemia? Anemia is usually defined as hemoglobin below 13.5 in male and below 12 in females. Now, somebody will define it also by the hematocrit below 36 in female and below 41 in male. Now, clinical features we all know: palpitation, fatigue, exertional dyspnea, ejection systolic murmur on examination. Patient will have pallor, conjunctival pallor, palmar crease pallor, glossitis, iron deficiency, anemia, B12, and folate deficiency. Those three, they give you glossitis. Koilonychia, this picture, you will see it definitely in the exams. They love it. You will see it only in the exam, not in real life. All right. It signifies iron deficiency anemia. When you see koilonychia means iron deficiency anemia. All right. Now, what do you do for any basic anemia workup? You do CBC and reticulocyte count and peripheral smear and iron profile. Now, depending on macrocytic or microcytic anemia, you may also order B12 and folate. تمام؟ بس هذا البيسك for any anemia. You will do CBC, reticulocyte, iron profile, B12 and folate, and peripheral smear. Somebody will also do what? Will do LDH and liver function test عشان يشوفوا total bilirubin. Now, because in hemolytic anemia, you will have high total bilirubin because of unconjugated hyperbilirubinemia, and also you will have high LDH because when the RBCs rupture during the hemolysis, the LDH inside the RBCs will be released into the blood. That's why you will have high LDH. However, high LDH does not only mean hemolysis. It may also suggest malignancy, for example. And during malignancy, same thing. The turnover of the malignant cells, the turnover and the destruction of the malignant cells, when they grow, then they undergo a turnover. They will increase the LDH in the blood. Anyways, so this is the basic workup for anemia. Now, how do you define anemia? Now, depending on the reticulocyte count, if it's more than 2.5, the reticulocyte index, it means hemolysis or hemorrhage. And if it's below 2.5, the reticulocyte index, the retic index, if it's below 2.5, it means you have something else other than the hemolysis or hemorrhage. Now, this is not the best classification, I would say. This is the best classification, especially for medical students. You classify anemia based on the size of the RBC. If it's small, we call it microcytic. If it's normal, we call it normocytic. If it's large RBC, we call it macrocytic. All right. And how do we know the size of the RBC? Based on the MCV, mean corpuscular volume. Based on the MCV, we can tell whether this is microcytic, normocytic, or macrocytic. All right. Now, hemolytic anemia is usually normocytic anemia. Hemolytic anemia is usually what? A normocytic anemia. All right. Now, microcytic anemia, remember this, take-home message. Any defect in the heme synthesis will give you microcytic anemia. And any defect in the DNA synthesis, you know the hemoglobin, guys. Hemoglobin is heme plus globin. Globin is a protein, okay? Heme. Any problem with the heme synthesis, which is the other component of hemoglobin, will give you microcytic anemia. And any defect in the DNA itself, like B12 and folate deficiency, you will get macrocytic anemia. And any hemolysis will give you high reticulocyte count. All right? Type. So microcytic anemia means MCV below 80. It means defect in the heme synthesis. For example, iron deficiency, lead poisoning. Lead poisoning affects the heme pathway. The lead poisoning will affect the heme synthesis pathway. Sideroblastic anemia will affect the heme synthesis pathway because there is an ALA enzyme defect. This ALA enzyme defect will give you sideroblastic anemia. And this is in the heme synthesis pathway as well. And if you revise the biochemistry, you will see in sideroblastic anemia, it affects the heme synthesis pathway. Lead poisoning also affects the heme synthesis pathway. Now, anemia of chronic disease can also give you microcytic anemia. All right, but usually you will see as a normocytic anemia. Now, defective globin chain, like in thalassemia, you will get also what? Microcytic anemia. Now, the top 2 differential of microcytic anemia in real life practice is going to be thalassemia and iron deficiency. الأذرز هم الأنيميا of chronic disease, lead poisoning, and sideroblastic anemia. All right? Now, if you have a normocytic anemia, it can be hemolytic or non-hemolytic. How do you differentiate? Based on the reticulocyte count or reticulocyte index. If you get it high, more than 2.5, then you are dealing with hemolysis. And hemolysis is further divided into intrinsic and extrinsic. And keep in mind, in your exams, they love to ask you about which one of the following is an intrinsic cause of hemolysis, right? ويحط لك مثلا G6PD, all right? ويحط لك أشياء أخرى not related to intrinsic hemolysis or intravascular hemolysis. All right? Now, a non-hemolytic anemia means a reticulocyte count below 2%. Okay? Iron deficiency anemia, early iron deficiency anemia could be normocytic. Anemia of chronic disease could be normocytic. Aplastic anemia is normocytic because you have a defect in the synthesis from the bone marrow. Chronic kidney disease, same thing. You don't have erythropoietin, معناته you have defect in the synthesis in the bone marrow. So aplastic anemia and chronic kidney disease, they cause normocytic anemia. Why? Because both of them, the erythropoietin is not working. It's not affecting the bone marrow. The bone marrow is not working either because you don't have erythropoietin or there is aplastic anemia, replacement of the bone marrow by fatty cells. All right? Type. Now, keep in mind, in the hemolytic anemia, it's normocytic, all right? But they will ask you about which one of the following cause intravascular hemolysis. Usually, they give you sickle cell and G6PD. The answer is going to be G6PD causes intravascular hemolysis. And now the extrinsic causes of hemolytic anemia means outside, the problem is not in the RBC itself, okay? It's something else, like infection, in malaria. In malaria, you will get hemolysis, right? In babesiosis, you will get hemolysis as well. Macroangiopathic hemolytic anemia. Macroangiopathic hemolytic anemia means aortic stenosis. In aortic stenosis or mechanical valve, the shearing force when the RBC, لما تعبر ال RBC على ال stenosed valve or the mechanical valve, it gets damaged, طيب, and this gives you what? Hemolysis. Now, المايكروانجيوباثيك hemolytic anemia زي DIC, TTB, and HUS hemolytic uremic syndrome يحصل microthrombosis in the blood vessels, in the small blood vessels, and this microthrombosis affects the RBC. نفس فكرة الاورtic stenosis. الفكرة إنه المايكروانجيوباثيك في السمول vessel, المايكروانجيوباثيك means in the aorta, like aortic stenosis and mechanical valve. Now, autoimmune زي warm autoimmune hemolytic anemia. Right? Warm autoimmune hemolytic anemia, which is IgG mediated, will give you hemolysis as well, but it's extrinsic. Extrinsic معناته not related to the RBC defect itself. لما نقول intrinsic معناته there is either membrane defect, enzyme defect, or hemoglobinopathy, زي sickle cell والhemoglobin C disease. All right? Now, if you have a macrocytic anemia, it means that the MCV is more than 100. It's either megaloblastic or non-megaloblastic. What's the definition of megaloblastic anemia? Megaloblastic anemia is defined as neutrophil count, as hypersegmented neutrophil, which means the number of the segments inside the neutrophil is more than 5. Usually, بعض الريفرنسز تقول لك 5 and more. In your exam, choose 6 and more, which means more than 5. 6 segments inside the neutrophil means megaloblastic anemia. So what's the definition of megaloblastic anemia? It means hypersegmented neutrophil. So what's the difference between non-megaloblastic and megaloblastic? It's the number of segments inside the neutrophil. طيب, in megaloblastic anemia, you have a DNA defect. folate deficiency, B12, and orotic aciduria. Orotic aciduria is a genetic disorder. Nobody will ask you about it except in USMLE. Now, defective DNA repair, like Fanconi anemia, nobody also will ask you about Fanconi anemia. But remember, when you have a DNA defect, you are going to get macrocytic anemia and megaloblastic anemia. That's why in liver disease and alcoholism, you will also get macrocytic anemia and also hypothyroidism. Hypothyroidism, alcoholism, liver disease, you get macrocytic non-megaloblastic anemia because they don't affect the DNA synthesis. But whenever there is something that affects the DNA synthesis, you are going to get megaloblastic macrocytic anemia. And again, megaloblastic means what? Means hypersegmented neutrophils. All right. Now, take home message: defect in the heme, you get microcytic; defect in the DNA, you get macrocytic, megaloblastic; high retic count, you get, it means you have hemolysis. Now, we are done with the basic approach to anemia. Whenever they ask you about approach to anemia, this is the approach to anemia. The alternative approach is going to be this one. This is the alternative approach, but the easier approach is this one by the MCV. All right. Now we will go into the blood film. We'll talk about the blood film because these pictures, they always bring it in your exams.